All right, let's bring in the top doctor in British Columbia, Dr. Bonnie Henry, BC's provincial health officer. She is in Victoria today. Dr. Henry, always good to see you. I know it's busy. Thanks for your time.
Oh, thank you for having me.
So let me ask you about the cases in British Columbia and what the takeaway is there as far as you're concerned.
Yeah, so we've been looking for this. We have a fairly robust surveillance where we do whole genome sequencing on a large number of PCR positive tests over the last little while. So the first time it came up was in late November, and as of the testing this week, I can update our numbers. So we're around 12 of the viruses that have been detected so far. So we're not seeing it take off. It definitely is here, but it's one of the ones that right now is in smaller numbers compared to the variants that we're seeing cause most of the illness here in BC right now.
Can you give us any indication as to where the cases are being traced to, sort of the genesis of them?
So where we've picked up this XBB.1.5 has been in the Lower Mainland, so in what we call the Vancouver Coastal and Fraser Health region. So that's the most populous region. So it's not surprising that we see it there first. I think there's a couple of things that are really important. Yes, it's likely to increase given that it is, what these viruses do is they change to make to have survival, and their survival means they can transmit more easily, but they're not necessarily causing more severe disease. I think that's really important. And the things that we know make a difference in protecting from transmission of infection and continuing that strong protection against severe disease is making sure you're getting up to date on your vaccinations. And for everybody, that means getting that bivalent booster. If you haven't had it yet in the last 6 months, now's the time to get it.
Is there any indication as to whether these cases are travel related?
And we can't tell that from the type of surveillance that we're doing. So they've arisen in some of the community surveillance, in some of the wastewater surveillance. So it's hard to tell where they actually came from. It's our way of understanding which are the variants that are causing most illness in the province right now.
I'm curious whether there is more safeguards that can be taken, or do you think British Columbia right now has the proper measures in place?
Yeah, I think this is one of those things we all need to continue to be aware that this virus is circulating. It's changing because that's what viruses do. And this one is even more infectious. And it's infectious with a smaller amount that can infect much more easily in the back of the nose and the throat. So the things that we know make a difference are staying up to date on your vaccinations. Getting that booster dose is really important for short-term protection against infection, but especially for longer term protection against more severe illness. And then all of those things that we know work for COVID, they work for influenza, they work for RSV, the other things that are making us sick right now too. Staying home and away from others if you're sick, wearing a mask if you have mild symptoms or you're concerned, or for extra protection when you're in those crowded indoor spaces. Washing your hands regularly, paying attention to ventilation. Those are the things that will make a difference for us as we go through this next few months.
So more transmissible but less severe, and that, of course, is good news.
It's good news in a sense. It means that as long as we keep our immunity up, and that means keeping up to date with vaccinations, making sure that we're doing all those things to prevent spread to others, then we're likely to see this one increase and compete with other viruses, other strains, other subvariants as well.
I know you're a keen observer as well in terms of what's going on internationally. Can I ask your thoughts on what we're seeing in China, the big surge that's going on, the lack of transparency by the Chinese government, Dr. Henry, in terms of how many cases they have, how many fatalities they have, and what's going on with their healthcare system?
Yeah, it's very challenging there. And I think first and foremost, this is another extremely difficult time for people in China, all over China. That is got to be our primary concern. And as a global community, doing what we can to support people to get vaccinations that they need and the healthcare that they need. In other sense, we are seeing that they are sharing finally some of the data on what types of variants are causing illness there. It is Omicron, and we learned this quite a few months ago that Omicron, those measures that we took that worked with other strains of this virus just don't control Omicron. It spreads that much easier. So making sure that we know what strains are spreading, and we're seeing mostly it's BA.5 and BA.7, which are ones that we've seen here before. So that's good, and hopefully that'll mean that less severe disease if they can get more people vaccinated there in China as well.
One last question. As of tomorrow, Canada will be asking for travelers coming in from China to take a COVID test prior, Dr. Henry, to getting on board their flight. Does that make sense? How effective is that?
I think it's one of those things where it's not going to prevent strains from coming here. And we know that. We know that from other times that we've tried to do this sort of a measure. But it is an important measure for people to think twice about going to China, about traveling if they're sick. And I think as a global community, it sends the message that we're here to make sure that we're all working together to try and support and understand what's going on in China.
Dr. Bonnie Henry is the top doctor in British Columbia, joining us today from Victoria. I know it's busy as always. We always appreciate you taking the time for CTV News, Dr. Henry.
Thank you.